Pharmacogenomics plays a significant role in optimizing therapy and reducing adverse events in the fields of gastroenterology and hepatology. Here are some key aspects of how pharmacogenomics can be applied. Personalized medication selection. Pharmacogenomic testing can help identify genetic variations that impact drug metabolism, efficacy, and safety. This information enables clinicians to choose medications that are more likely to be effective and well tolerated by individual patients. For example, genetic testing can determine a patient's metabolizer status for drugs such as thiopurines, which are used in inflammatory bowel disease, or proton pump inhibitors used in gastroesophageal reflux disease. This knowledge guides medication selection and appropriate dosing adjustments to optimize therapy outcomes. Prediction of treatment response. Genetic variations can influence an individual's response to specific medications used in gastroenterology and hepatology. Pharmacogenomic testing can help predict treatment response, enabling clinicians to select the most effective medication for each patient. For example, in hepatitis C treatment, testing for the IL-28B genotype can identify patients with a higher likelihood of responding to direct-acting antiviral therapy. Identification of drug-related adverse events. Some adverse drug reactions are associated with specific genetic variations. Pharmacogenomic testing can identify patients at increased risk of adverse events, enabling clinicians to choose alternative medications or adjust dosages accordingly. For example, testing for the HLA-B5701 genotype can help identify individuals at high risk of developing severe hypersensitivity reactions to abacavir, a medication used in HIV treatment. Dosing optimization. Genetic factors can impact drug metabolism and clearance, leading to variations in drug concentrations in the body. Pharmacogenomic testing can provide insights into optimal dosing strategies for medications in gastroenterology and hepatology. For instance, testing for CYP2C19 genetic variations can guide dosing adjustments for proton pump inhibitors to achieve adequate acid suppression. Treatment of hepatitis B. Pharmacogenomics can assist in the management of chronic hepatitis B by identifying genetic markers associated with drug response. For example, genetic variations in the UDP glucuronidyltransferase 1A1 UGT1A1 gene influence the metabolism of entecavir, a commonly used antiviral medication. Pharmacogenomic testing can help determine the appropriate dosage for individuals with specific UGT1A1 genotypes. It's important to note that while pharmacogenomic testing can provide valuable information, it should be integrated into comprehensive clinical assessments and guidelines. The field of pharmacogenomics is continually evolving, and more research is needed to establish evidence-based guidelines for specific medications and genetic markers in gastroenterology and hepatology. Collaboration between gastroenterologists, hepatologists, and clinical pharmacologists is crucial to effectively implement pharmacogenomic information into clinical practice and optimize therapy while reducing adverse events.